Hello, and welcome to Northwest Focus. I'm Cathy, Rhodes, your host. Our topic today is health. We're going to be talking about running and walking and staying active. We have here in the studio with us today Dr. Steve Tillett.
Hi.
Welcome, Doctor.
Thank you.
And he has over 15 years experience in the medical field, and he's also the chief of podiatry, did I say that right?
You did
For
great.
Legacy. Welcome.
Thank you. Glad to be here.
Glad you're here. So we're talking about exercise today and staying active and staying fit.
Yes. And we need our feet to do that.
Now, and why are we so concerned about that?
Well, you know, it affects our health in so many ways when we aren't fit. And it affects our heart. You know, it affects our circulation. So the more active we are, the more active we stay, the better we are at preventing or maybe postponing certain disease processes. So.
Okay. And just in our region here in the Northwest, it's popular to get exercise in this way by walking and running. What's been your experience with feet in this area?
Oh, you know, I get to see all of the issues with feet, but I also get to realize that we're blessed to live here. A few years ago, I got to award an award to the former mayor of Portland for being the #1 walking city in the United States. We have so many trails, so many wonderful places to walk that it gives people a better opportunity to get out and be active. But I get to see the injuries that come with that.
Right.
So one of the most common injuries or overuse problems is heel pain. We have things from tendonitis to significant heel pain to even stress fractures.
Wow. Yeah, it's when you're on your feet that much, walking and running, it's your symptoms are bound to occur. Now, for someone who is just starting out, either walking or running, how do they make a decision on what type of activity is best for them?
That is such a good question, and one of the hardest things to really make a choice, and we really just got to be careful not to overdo it and start out a little at a time. And so I would always recommend start out walking first. Maybe if you're 20 years old and very fit, you could start out doing a little jogging, but test the water, see how you do, see how your feet, your knees, your back, your hips hold up, and then increase slowly.
That's a good point. That's a good point. Now, for someone who may have had some issues with joints or just aches and pains in their body, or maybe they're a little bit heavier and they want to get started, are there benefits to starting out with a walking program versus running?
Oh, without question. And you know, not all of us are designed to run. Your body would probably handle running no problem. Me, I'm much better for walking. You know, our body mass each time we take a step is increased by 4-fold. If we weigh 100 pounds, that's 400 pounds of impact on each step we take jogging. So
that's amazing.
It is. So it's a lot of force on a bad knee from an old sports injury, or just a knee that's getting arthritis in it. So it's always important to consider, you know, where should I start? And I would always err on the side of caution. And, you know, walking is much safer on the body. I know that we get impatient as people, want to get out there, run, get our heart rate up. So.
Okay. Now, what about some of the effects? You've talked a little bit about the effects on the body and some of the injuries that you see. What are some of the symptoms that would let someone know maybe they have a more serious problem versus just maybe they tweaked an ankle or...
Absolutely. I'll tell you, we get aches and pains in our feet, and there's been a myth of, well, our feet are supposed to hurt. We overuse them a little bit. It's not true. Our feet are designed to do really well. So if we're having pain, it needs to raise a red flag. But what I would look for is any pain that's of a significant level that maybe a Tylenol or Advil doesn't take care of.
Okay.
Or if that persists and doesn't improve over a week, I would have a podiatrist look at your feet and see what's going on. X-rays can be very helpful, or just a physical exam can tell you.
Okay, so it's important to take your feet seriously as far as aches and pains and those kinds of things. Now, what about fractures? Do you see many people that encounter stress fractures from being on their feet from overuse?
Absolutely, and interestingly, women, much higher percentage. I think they're just tougher. They will run through pain much longer and end up with a stress fracture. And so you have to watch your feet for any changes. It's not always this glaring problem. You don't see a deformity, but maybe redness and warmth to the area and pain. You see swelling and redness, and that doesn't go away within a day or two. We need to have that looked at.
Okay. Now, what about, let's say an injury just happens, maybe it's something new that occurs. What are some good treatment principles for someone who has began to walk or run? What should they do should they encounter an injury?
Very good question, and there's this nice acronym for it, RICE.
Okay.
R-I-C-E, and I think many people have heard that before, but the rest, ice, compression, and elevation is kind of the thing we kind of have to look to and say, okay, let's do that and see how it responds over the next 24 hours. You feel great within a day, wonderful. But we really have to look at that. And one of the hardest things for runners and walkers is our dedication. And it's so hard to stop, even though we're having pain. But that rest, I think, is the first one for an important reason. We don't want to push through an injury. So we have to get off of our foot, let it heal. And what I've come up with over the years for patients is activity as tolerated.
Okay.
So if it's causing pain, it means you're doing too much. So even though we may want to try and push it and see how we're doing because we're recovering from an injury, if your body says, hey, that hurts, it's for a reason.
It's
and
best
it should be
to
looked
listen.
at.
Yes. Well, what about age? So everyone's at a different stage. Here in our area, I've seen people from young kids to older ones running it. What about for injuries for young people? And then maybe talk about injuries for older people. Is there a difference, or are they the same as far as treatment?
There is almost no difference. The biggest difference is the rate at which they heal and get better. They get this Superman complex sometimes when they're young and want to just run through it, figure they will heal. But the key is listening to those symptoms and responding appropriately with the RICE. Older patient just may heal a lot slower, but it's still important for them to not get frustrated, be patient with it. And there's no limitations on elderly patients and whether they can run or walk. But the most likely scenario is walking's going to be better. If they've had a busy, active life and they have a bad hip or a bad knee and it's arthritic and it's painful, they'll be less traumatic by walking.
Walking, okay. Now, what about the shoe? So,
yes.
Some runners take it real seriously, or walkers, and they'll go to a shoe store.
Yes.
And
there's different kinds of shoes.
Right, and some might just run out to your local department store and grab a pair of shoes. Is there any learnings you can tell us
I
about?
think there's a big benefit to going to a running store and being fit properly, or at least going somewhere where they know to measure your foot and know that there's actually more than one measurement. It's just not about how long your foot is or how wide it is. They measure heel to toe and heel to ball of the foot, which most people aren't aware of.
Right.
And so you want to be put into a shoe that fits your foot and the shape of your foot, because shoes are made sometimes very straight.
Right.
Some of them have what we call a curved last, and you want that to match your foot, and you need a professional to help you with that.
Okay. And what about like insoles and steps and those kinds of shoe aids that you see in the store or that some people use? Would you recommend?
Absolutely. I think those are fantastic. You have all of the over-the-counter devices, which range from very thin and soft and squishy to thick and soft and squishy. Maybe a little bit of support, but they're all made to someone's foot. Maybe Tennessee. Not my foot, not your foot, but so I just tell patients, don't spend a lot of money. Don't spend more than $50 on something made for someone else's foot. But if you find something comfortable and it helps your foot, fantastic. Now, if you want to go to the extent of really extending your warranty, maybe a professionally molded, biomechanically corrective orthotic device, that rigid, hard plastic thing that the foot doctor can mold your foot for and put in your shoe. When I first started practice, if it's not broke, don't fix it would be my answer to the question of, would I do better with an orthotic? And the patient had no problems. Now my answer is different. It would be,
Really?
you know, I think it'll extend your warranty.
Okay, okay. Well, let me ask this question, and in regards to running
Yes.
and walking and
Yeah.
exercise and just the craze about it in our area, how much is too much?
Well, you know, if we listen to our feet, that's going to be the biggest answer. But we've gone to the extent where a very popular thing has become barefoot running.
Barefoot running.
Barefoot running. And they've gone to the extent of even now trying to help some people get used to that and created almost like a sock with toes in it, and then they rubberize the bottom. And it's called a barefoot running shoe. Or a 5-finger shoe, which is a unique term.
Okay.
And you know, we're not all designed for that. It absolutely takes away any support, or very little protection comes along with that. My answer to that to people, you know, some people may tolerate it. They're small enough, their feet are in good enough shape, they can tolerate it, but they adjust the way they run when they run barefooted. They shorten their stride to decrease the impact, and all of those things. So running's different. They may end up with different aches and pains, but 90% of them end up with heel pain. And my answer to people is, well, some people can walk on hot coals, but not everyone can.
Right.
I'm not going to do it.
Yeah, and is it bad for your the bones in your feet?
Absolutely can be hard on the bones in your feet.
Okay, so you might want to be careful about
Yeah.
that one. Okay, and what about shoes for toddlers? More toddlers and younger kids, little kids are now walking and running. What points of tips or experience do you have to share with us regarding little feet?
That one is so easy. There are children's shoe stores, and I would go and make sure that those individuals know how to fit your toddler's foot, that they can put a finger in behind the heel to make sure it fits in there just about part of the way down to the first knuckle, and that there's enough room in the toe box. Having someone that knows how to fit your toddlers is important, and that they're going to outgrow them very quickly. You know, a runner may need to change their shoes every 300 to 400 miles, but a toddler, they grow at different rates. And as soon as their toes are at the end of the shoe, or you look at where the laces line up, and there's a variance in how well the two sides line up, it's time to change the shoes.
Time to change the shoe.
Yeah.
Now, what about other sports here that you're seeing people with feet problems for? Besides running and walking, are there any other really popular sports that are causing aches and pains for people?
Absolutely, absolutely. Our kids are all involved with so many of these sports that a lot of pressure, a lot of pounding. Adults are more involved with sports these days, and we end up with a lot of big toe problems and other problems associated with maybe the cleats or the basketball shoes or the shoes they would wear for racquetball. And so sometimes it's getting an orthotic into a shoe like that can make all the difference in the world.
That's great. Okay, so we've got just a few seconds left, and you've said a lot of really important things for the runner and walkers in our community. Let's just go over that RICE one more time.
Yes, rest. So we got to give it a chance to heal. Ice, because ice is a wonderful anti-inflammatory. Compression to just keep the swelling down, but also helps you rest. And elevation, just stay off your feet.
Thank you so much. As we're staying active, we need to remember that.
Yes.
Well, thank you, Dr. Tillett, for joining us today. And thank you so much, viewing audience, for tuning in. We do look forward to seeing you next time on Northwest Focus.
You've been watching Northwest Focus, a public affairs presentation of KNMT. Opinions expressed on this program do not necessarily reflect the views of KNMT or the Trinity Broadcast.